Hi, my name is Morgan, and I'm super excited to be applying for this clinical experience at UCHealth Longs Peak Hospital. First of all, thank you for taking time to review my application. I really appreciate your dedication to us students. I really feel I'm able to remain flexible in a clinical setting and stay calm and confident when unpredicted situations may arise. My past and current experiences in the inpatient setting have really allowed me to practice and refine my ability to be flexible. Whether it's, for example, being willing to shift focus to lend a hand to a colleague when a chaotic situation arises, or being creative and problem solving when a patient say they don't speak the same language as I do, or being flexible in how I approach the plan of care with a patient because maybe they don't really have any social support. Additionally, as I continue finishing my EMT certification and gain experience in this realm, I'm continuing to advance my ability to be flexible because, especially in this area of medicine, there is very little predictability. Some of the strategies I use to be flexible and successful in the clinical environment include being as prepared as I possibly can and practicing important skills often. Preparing by reviewing the patient's charts in detail, if at all possible, allows me to have a good understanding of the knowns. So when an unpredicted situation arises with the patients, I can adapt based on the knowledge that I already have. I also find practicing important skills often allows them to become more of a muscle memory when I need to adapt to a situation quickly. With my dedication to pursue a career in inpatient PT, I really believe I could make the most of this experience with LPH. I believe that I thrive in a fast-paced environment and I'm comfortable with the equipment and setting of a hospital, and I work well and understand the roles of the interdisciplinary team in the inpatient setting. I'm eager to continue learning in this setting, and I will not shy away from the more challenging tasks associated with the hospital environment. I'm willing to work hard and learn outside of my comfort zone. I feel I'd be able to adapt to this clinical rotation quickly and work well with the team to really maximize the quality of care for patients. In my first clinical rotation, my CI noted that I could improve on my efficiency in my new patient evaluations, and I was sometimes taking too much time to get some of the history before completing the necessary tests and measures. I accepted this constructive feedback by reflecting on what I had done in my previous patient eval. Then I made a plan on how I was going to move forward, asked my CI clarifying questions as needed, and verbalized my plan with my CI just to check my understanding. If selected for this opportunity, I would openly communicate with my CI at the beginning of the rotation about my preferred method of feedback, while also listening to their preferred method of giving feedback. Then I would continue to keep that open line of communication and make improvements to our system if needed. I know CIs are really busy practitioners, so I would make sure that we have an efficient system. If selected for this clinical education experience at LPH, I will definitely review in detail content regarding management of acute conditions and reach out to my close mentors that can help guide me to success in this setting. I've been successful in course material covering these related topics thus far, so I will continue to retain and advance this knowledge. I also have mentors that I work with currently that also work in the acute care setting that I would definitely reach out to for specific advice and guidance. I will also be taking the Neurological Management elective course at Regis before beginning this clinical, which I'm excited for to advance my knowledge of this patient population that is often seen in acute care. I really feel I have the tools, determination, and support to really thrive in this clinical opportunity. I was born and raised right here in Colorado, and with my family deeply rooted in this community, I plan to stay in the northern Colorado area after graduation. My goal after graduating is to work in an inpatient setting, and honestly, starting my career in a fast-paced acute care setting serving some rural populations like LPH would be a dream. Thank you so much for considering my application, and I would be honored to have the chance to learn from and contribute to the LPH team.